I'm Dr. Haley Todsen, a board-certified emergency physician practicing for 20 years, a Menopause Society certified practitioner, and the founder of Optimize Integrative Health.
My name is Bailey. I am the family nurse practitioner here at Optimize Integrative. I have 7 years of experience in the medical field. I am functionally certified, and I love focusing on longevity within this practice, and we hope you enjoy this podcast. So in today's episode, we're going to discuss perimenopause and how it can start earlier than you think. So if you are in your 30s and 40s experiencing weird symptoms, listen to this episode. And if any of these you identify with, please book a consult with us if you're located in any of the states that we're licensed in. So let's start with a few symptoms that one might experience in their 30s and 40s. The first is very erratic menstrual cycles. The next is very poor sleep quality. The other is packing on weight despite rigorous workouts, eating healthy. So we'll talk about some of those symptoms and how it can be a part of perimenopause, but it's also important to get a full panel of labs checked out if it's not part of perimenopause. So I'll let you start with the first one.
So exactly. So what is perimenopause? So perimenopause is this period of time before menopause. And menopause is 1 day. Menopause is 1 year after you have stopped having a menstrual cycle. Everything before that when you're having symptoms is perimenopause. After that, it's postmenopause. So we're going to talk today about perimenopause. So that is when our hormones begin fluctuating erratically. So we know our progesterone goes down and then our estrogen really cycles in chaos. And so that's what gives us all these symptoms, the fluctuations of these hormones. Testosterone also plays a role too, but really when we talk about this, we're going to be talking about estrogen and progesterone. So you may feel one day like you are crying no matter what, even though nothing has upset you. You may feel hot flashes that you can't sleep. You may have noticed weight gain, particularly around your abdominal section. Those are mainly the complaints, mostly vasomotor symptoms that we talked about, hot flashes, inability to sleep, and then the weight gain.
Yeah. I will say a very vague symptom that women get early in perimenopause that flies under the radar is your menstrual cycles changing. So this can look like a 28-day cycle shortening to a 24-day cycle. There's not necessarily anything wrong with that, but it could be a sign that your progesterone is low and something to pay attention to. Now, when would we be concerned that you would need treatment with hormone replacement in perimenopause? It would be if you're having very erratic menstrual cycles and you can't predict when you're ovulating, you're going more than 40 days between cycles, or they're shortening or becoming more heavy, then it might be time to reach out for help. But that's really one of the first symptoms that is really inconspicuous with a lot of females in their 30s and 40s. They just attribute it to getting older, and yeah, that's part of it, but it could also be that your body is starting the process of perimenopause, which can take place 7 to 10 years before menopause.
Exactly. And then another symptom that we see a lot is the brain fog. I just can't remember things. I put things down. I can't find them. I'll tell you, I went into perimenopause early, which is actually part of the reason Optimize Integrative Health exists. I had been to many physicians, couldn't figure out why I felt the way that I did. My symptoms of perimenopause was anxiety, I couldn't sleep, hot flashes, I couldn't even drink a cup of coffee without breaking out in a sweat. I couldn't blow dry my hair without breaking out in a sweat. And so these signs I needed help with. The part of it was the weight gain also, that I would continue my workouts, I would eat healthy, whole foods, the right amount of calories, what I thought, I would strength train, but yet continued to have the weight gain and really needed help, went through many physicians. And so it's really important to not give up on yourself because you know how you're supposed to feel and how you could feel again.
Yeah. And another one you mentioned, the sleep component, that's another symptom that really flies under the radar as well. So again, if we're looking at females in their 30s and 40s that may be perimenopausal, sleep quality can decrease. They'll stay awake for hours in the bed, unable to fall asleep, or they'll wake up at 2 o'clock in the morning, go use the restroom, and then they're unable to fall back to sleep. And I feel like this is an opportunity for a female to get her hormones checked, but most of the time they may be diagnosed with insomnia and given sleep medication, and that might not help the issue. So again, if there's a woman who's struggling in her 30s and 40s with sleep, it is so important to get your hormones checked instead of just going to the doctor, being prescribed sleep medicine, because it may be completely unnecessary.
So if you are in your 30s and 40s and experiencing any of these symptoms, please reach out to us and schedule an appointment.
This podcast and all related content are provided for educational and informational purposes only. Nothing discussed on this show is intended to be, nor should it be interpreted as, medical advice, diagnosis, or treatment. No doctor-patient or provider-patient relationship is created by listening to this podcast, watching this video, or engaging with any of our content. Although I am a licensed physician and Bailey is a licensed nurse practitioner, we are not acting as your personal healthcare providers in this setting. The information presented is general in nature and may not apply to your individual medical situation. You should not rely on anything discussed here as a substitute for professional medical care, diagnosis, or treatment. Always consult your own physician or qualified healthcare provider regarding any medical condition, medication, supplement, or health decision. Never disregard or delay seeking professional medical advice because of something you heard on this podcast. Optimize Integrative Health, its clinicians, and its affiliates expressly disclaim any and all liability for actions taken or not taken based on the information provided in this program.